OxyContin was developed in the mid-90s as a time-released medication prescribed for moderate to severe pain. Over time, it has become one of the most abused prescription drugs in Canada. I mean, it's easy to crush, chew, inject. In fact, some have even referred to it as hillbilly heroin. So as of today, OxyContin's manufacturer is phasing it out, replacing it with a reportedly less addictive drug, and that one's called OxyNeo. Joining me with more on this is CBC medical specialist Dr. Karl Kabasele. Welcome back, Karl. Why the replacement? Well, tell me more about what's behind it.
Well, as you mentioned, even though it was designed in such a way as to release the drug oxycodone in a gradual way, if you take it all at once, you can experience this high or feeling of euphoria, and that's what someone who becomes addicted to it is seeking. So what they're doing now with this new formulation of OxyNeo is they're making it more difficult to crush and more difficult to dissolve in water. So when you try to dissolve it in water, it turns into kind of a jelly substance and you can't inject it. So what the manufacturer is trying to do basically is reduce the chances of abusing the medication while still allowing people who need it for pain to take it as normal.
So do you think it will cause, or it will end those problems of OxyContin, but will it create new ones, I'm wondering, you know?
Well, it could. So people who are already sort of misusing OxyContin, crushing it and chewing it, injecting it, what have you, are going to now be left in a position where they won't have access to that pill anymore.
Right.
And assuming that these defenses that they've put in the new pill will work, they won't be able to sort of access the oxycodone in the same way from that new pill. What does that mean? Well, for communities that are perhaps more isolated and there are no facilities there for people who might want to detox off of oxycodone or get help with their addiction, then they're faced with a choice. They can either go through a painful withdrawal process, not by choice, but just by the fact that they don't have the pill, or they may end up turning to other, sometimes illegal substances to fill that void that's left over from not having oxycodone.
What do you say to the critics who, because of the replacement, say that because at some First Nation communities addicts make up more than half the population, that we could see a public health crisis because of the switch? Well,
yes, exactly. So with a lack of medical services to help people to get off of these medications, you're faced with, well, there are a number of public health implications. So number one, the remaining OxyContin that's on the streets or available becomes more scarce. So the price goes up, and that creates a burden on people who are already struggling to survive.
Right.
Number two, with the scarcity of OxyContin, people begin to share it. And if they're injecting, they may end up sharing needles, passing along infectious diseases as they do that. So that's a problem as well. So what we're faced with here is an acute manifestation of an ongoing problem, which is a lack of addiction services in remote communities and in Native communities.
For people who were not abusing OxyContin, taking it, and then now they have to make the switch to OxyNeo, what kind of difference are they going to feel, or is there going to be anything?
Well, that's the interesting thing. There'll be actually no effect. If you're able to secure a supply of OxyNeo, and you're taking it, you're swallowing it, you're taking it as prescribed without crushing it, you'll feel no difference between the two pills.
So what's your advice then for people who were on OxyContin? And maybe, as they're watching across the country, hearing, I didn't know this was going to be replaced with OxyNeo.
Right. So I think the number one thing is to work with your doctor and find the appropriate sort of pain management strategy that works for you. OxyContin is a very serious and powerful, potent medication. We shouldn't take it lightly, and unfortunately, I think it's been overprescribed for types of pain like backache or toothache that it's not really necessary for. So start low, start with the least potent medications and work your way up. If you're already dependent on OxyContin, and if you're fortunate enough to have access to these services where you can get help with your addiction or with your dependence, absolutely access them when you're ready to do that. And otherwise, I mean, I'm hoping from a policy perspective that people who need the care and the help with the addiction are going to get it, and it's not clear at this point whether that will be the case.
All right. Thank you so much, Karl.
Thank you.
CBC medical specialist Dr. Karl Kabasele right here in studio.